I'm here, yeah, Marina.
Yeah,
Just letting you know I'm here.
okay. I've made you co-host.
Baru nampak. We will chat from from the Zoom here, right?
Yeah.
Okay. Trying to write my script.
But from time to time, I'll check what's happening in Facebook lah.
And also,
I
that's why
can.
I asked
Yeah,
anyone like Sue Ann can help
yeah,
to
yeah.
check in or not
Hoping
also.
that so Anne can help.
Hi, everyone who have just joined us. We will start very, very soon. Hi, Heidi. We'll see you real soon, yeah?
Hi, Heidi. Thanks for joining us.
Alrighty, it's 8 p.m. now. Hi, everybody. Welcome, welcome. We have quite a number of people here in Zoom and hopefully in our Facebook Live as well. Okay, without further ado, let me just introduce both Marina and I. So before we start off, I would just like to say a very, very thank you for our organizers, ACBS Malaysia Chapter and MSCP, in organizing this whole talk, our second year berturut-turut doing this webinar for World Mental Health Day. And I have to say that it is because of the team behind us, helping us with our posters, designing, running all the Facebook Live, all the tech support, answering questions, requests from people, which helps us to have capacity to really focus on preparing for this talk. So just a really, really huge thank you for the team behind Marina and I doing all this behind the scenes work here. So Marina here is our committee member for ACBS Malaysia chapter. She is the member at large up until next year. She has an interest in expanding ACT beyond the therapy room. So we do need to watch out for this space to see what Marina will have for us in terms of like using ACT in our daily life, not just in session, in therapy. And Marina has been learning ACT since 2018. Whereas for myself, I'm Carmen. Marina is a psychiatrist in government sector as well. And as for myself, I'm Carmen. I'm a clinical psychologist in the private sector. I hold multiple roles in my professional and non-professional setting. So in ACBS Malaysia chapter, I'm the president-elect until next year, and next year I will be the president. And I'm also an exco at the Malaysian Society of Clinical Psychology, MSCP. So this webinar is really how Marina and I are in a way giving back to the society, our associations that we're associated with, and hopefully next year, others who will be in our spot will also do the same thing in servicing the community and our societies. I have been interested in and getting to know ACT since about 2017, but only really started learning, exploring personal development in ACT in 2018. And I have a special interest in practicing ACT in the aging community. That is something that's close to my heart, on top of doing all the corporate work, therapy, and all the trainings that I've been doing now. So without further ado, let us start off with our topic for today. The theme for this year's World Mental Health Day is mental health at the workplace. So just a short information that I did my little research before we had our talk here. I noticed and realized that this taken from the WHO website, 15% of working age adults were estimated to have a mental disorder in 2019. And globally, an estimated 12 billion working days are lost every year to depression and anxiety at a cost of US 1 trillion per year in lost productivity. So that's quite a lot, and which is why the theme for this year is so important, especially for those of us who are working and those in corporate who are holding very high position and able to actually help form the mental health well-being of the employees, whether as an employer or as an employee. Over to you, Marina.
All right. Okay, so I think this team comes up at the right time, I think, because we've gone through, years before, we've gone through a lot of this MCOs, the COVID. So, and people were just, the team is always goes on about adolescents, and then what about those who are working? So
What
this year,
about us?
what
Us, the
about
mental
us?
health professionals, right?
Yeah, not just us mental health professional, but about those who's are in the working, in the those people who are working. Okay, so nobody talks about them. Okay, so people talks about the adolescents, people talk about the children, about their mental health. People talks about the women's, but then what about those who are working? Okay, so I think it came about at the right time, because when it comes, like when you introduced me, when you said that I have this interest in expanding beyond therapy,
Mm-hmm.
somehow I want to adapt this in the working environment, seeing using ACT as a way, as a helpful tool for those who's working, in order for them to have a meaningful life, meaning they're able to work, but then at the same time they're able to actually enjoy their life as well at the same time, either enjoy whatever that's important to all of us actually, because all of us are working. Even to me, those housewives are also working and
Yeah,
they're like 24 hours.
full time, no rest.
Like no rest, no holiday.
Yeah. So what kind of workplace stresses have you observed and noticed based on your observations, speaking to your clients, or you see at the actual workplace? Yeah, what would be those workplace stresses for you, Marina?
Will come with either acute stress, okay, very stressed, but it it's not, by the time they came to us, I think it's no more acute stress. It already up to the level where they already burn out.
Mm,
And usually it's related to how they felt they're being supported or not supported at the workplace.
mm,
That's one. Because sometimes they are place where they don't want to be, or they're working in an environment where they don't feel that they'll be understood. Okay, I'm using the words that my patients use.
mm.
Most of the time they're going on towards like, nobody understood me, nobody is willing to listen to me. I think that's the thing that are the few of the main kind of like issues. But it's not just the only thing, because sometimes they also have life events that's going on with their life. And but I think if the work environment is helpful, okay,
Mm-hmm.
they will not be as burnout. Because they do have some I even have some clients who came like, I prefer working because I find that my life outside there, my relationship with my family or my relationship with my spouse are the one that's causing me a lot of stress. And work
Mm.
is felt I'm safe. But what if you don't feel that importance, or you don't feel that you have this life at home or outside there, but then when you go to work also you don't feel that you're part of that work, right? Yeah.
Yeah.
What about you,
So,
Carmen?
well, for me, so what I did was I did an informal research. I asked among my clients, among my friends, and on social media, please tell me your most toxic workplace experience at your workplace. And there were a lot. There were a lot, to the point that because I used the Instagram's question and the word count was too little. So they gave me 1, 2 lines, and then after that they sent me an essay about what were their workplace experience. And some of the common thing that I realized that impacts what are the workplace stresses for them is that there's a lot of verbal harassment from either their colleague or their boss.
Mm.
So that is really something that is very concerning. There are comments of like bosses telling them, "Hey, you stupid ka? What kind of person are you?" And then there's also the point where the empathy, when the staff is injured and need time off to go seek for treatment, needed some change in their work arrangements. So all these are not being heard. Instead, they will say, "Hey, why do you still need MC to do this? Aren't you already all healed up?" So those are some of the things that I've noticed. And others, at what kind of other stresses at work, which might not look like stresses, but can contribute, like you say, Marina, to burnout, is that sometimes the employee is being underused,
Mm.
underused in their skills, or being underskilled for the work they need to do.
Mm-hmm.
Too much workload or workplace understaff. So if one staff leaves, then I have to take over the other person's workload, but I'm not being properly compensated, long hours, unsocial or inflexible hours at work. Oh, recording in progress. Okay.
Oh, okay.
Uh,
Yeah.
unclear, unclear job roles, under or over promotion. That is also something that can contribute to workplace stresses, organizational culture that enables negative behaviors. Well, behaviors that are, for example, the workplace harassments, the verbal, how you comment about the other staff's work. So these are risks to mental health at work. So that is my experience observation from that.
Mm,
Yeah.
mm, mm.
And so do you think this is something that is also common when you observe with
Yeah, yeah,
the people?
yeah. I would have agreed with you because sometimes being unappreciated, okay, uh, being they don't feel that support that they require, they're not given, like when they have chronic illness, okay, the some of them comes to see me because they have PID. PID is this chronic back pain. Okay.
Mm,
And most of the time, they will, because of that pain, they have to be on MCs. And ended up, because it's been so long, and always they have this kind of like being stigmatized as being somebody who's just mengada-ngada.
mm. Oh, Marina, I tak dengar. Maybe need to be a bit louder.
Okay, it's like, uh, is this clear?
Yes, better.
Okay. All right, sorry about that. Okay, is sometimes I do get patient with chronic back pain. Okay, and
Mm,
they will complain that either sometimes the employer themselves will say like, why are you taking this MC so many times? Or sometimes their colleagues, they might get the support from the employer, but then the other colleagues will say bad things about them because they're always not there, right? They're on long MCs. So they felt that they're being judged because of their current illness when they just need that time to recuperate. They need that time to actually adjust to the pain that they have. Okay.
mm,
So they don't feel that they're getting that support. So ended up they get depression, they get burnout because of the lack of support that they do get. And but you have to look at the other, sometimes you have to look at the other side of those who's who has to replace, you know, if this person
mm,
to go on MC very frequent and they're already in the um on the schedule already, but then they can't go to work, so this other person have to replace. So those kind of, I think the employer themselves, they have to come in and kind of like help to reduce that burden on the staff that's left,
mm,
because
mm,
during the MCO, meaning that some of the staff are being taken away to take care of the COVID ward, and then the
mm,
remaining staff have to take care of the patient that's still there, and the workload is still the same. So that's just, I think, mm, if those are not being looked at, the understaffing, okay, the dissatisfaction, so of course people are gonna quit. Okay,
mhm,
and they might suffer mental illness, and not just mental illness, they might ended up suffering from other non-communicable disease such as hypertension,
mm,
diabetes, heart disease. So they're also at risk if, let's say, these are allowed to continue.
mm. It's about unsafe or even poor physical working conditions.
Mm,
And there's another thing that we also, I would say that the conversation
mm,
often revolves around the employee's mental health, mental well-being.
mm.
There's the other part of the side, of this story, which is that, which I hear from my client as the boss, okay? So this person is a boss of a small, medium enterprise, and he told me, look, all day in, day out, everybody is saying, take care of your staff, take care of your staff. Who takes care of me? The
Correct.
boss. When my staff takes leave, when I cannot find workers, and then I still need to pay all the fixed rent, all the salary, provide all the extra allowances and all those stuff. Who takes care of me? Is that something that I would actually be very curious of the audience as well. Anybody is in this position. Hey, I take care of everybody, but what about me? What about my interest here? Who is taking care of my mental health? If you have, please just put that on the chat box and we'll have a look at it. But yeah, Marina, what are your thoughts about this?
I, I, d- I think I'm in the government, so I don't deal so much with the corporate, those who are the higher, which means the employer. Okay, but I do meet those who are, they're in the middle. Okay,
Mm,
where they are supervising people, but at the same time they're being supervised. And then the other boss
mm,
atas.
okay,
Yeah.
okay, yeah.
So what happened is they're being sandwiched there. So
Mm,
to make sure that the staff are productive, but then at
mm,
the same time they have to answer to the boss.
boss.
Yeah,
Mm,
higher boss. So being in the middle, because they're also staff, but at the same time they are like the boss.
yeah,
Mm.
yep.
So they're struggling a lot because sometimes when you're at that place, you're on your own. Yeah,
Leadership is a very lonely place.
yeah.
I would say the higher up the corporate ladder you are at, whether in the hospital, mental health setting, or corporate, the lonelier you get.
Mm. But from my view, because I've seen this from my previous pengarah hospital lah, hospital
Mm,
director when I was in the hospital Permai actually.
mm,
He is he's the hospital director, but he himself will actually go down and then mingle with everybody. They just he actually, you can choose, okay, but at the same time you have to maintain the hierarchy. The hierarchy needs to be maintained, but at the same time, if you chose to be lonely, you will be lonely. But if you chose to kind of like, okay, let's meet up with those the rest, actually that can happen. It's just that sometimes we have to find the balance
mm,
between, yeah, between not being somebody who's a pushover, because sometimes when you're trying to be too nice, you become somebody who's a pushover. Okay,
mm,
then you have to maintain that kind of hierarchy at the same time. It can be very difficult to jumble that. I think
mm,
that's why sometimes people who's at that level, they're struggling. I've had some who are promoted into supervisors when they used to be workers. So
mm.
when they, some of them will just say that, no, I wish I am demoted. I've been asking my boss to demote me back. So I don't really
Ah,
deal with this. So really, if you can't find yourself on how you can actually manage yourself in that role transition, it can be very, very difficult.
And I would say that would also, number one, affect yourself
Mhm,
in terms of coping, inability to cope.
mhm.
And from there, that effect can also trickle down to the subordinates, which
Yes.
really segues very nicely into us talking more about what would be helpful for individuals and organizations to implement to
Mm.
foster a mentally healthy work environment. And one of them, hearing from you, Marina, I would say that actual training for this middle management group on transitioning, being in this position. Now I'm no longer just the subordinate, I'm also managing a team. So having training in that transitioning, training for mental health, helping this helping all managers, supervisors to
Mhm.
recognize and respond to their supervisees, subordinates experiencing emotional distress, learning how to build interpersonal skills like open communication, active listening, uh, foster better understanding of how job stresses can affect mental health and can be managed. I think this kind of training would be very helpful for the team and the organization as a whole.
Correct. I do agree with you, Carmen. I do.
Hmm.
Mm.
Is there anything else that you thought of that would
Mhm.
probably be helpful
Mm. I
for either
the
individuals or organizations?
I think the fact that the organization itself, the higher level, they should actually, as you said, they should put some sort of training to those who they've chosen as the leader. It's like, okay, I'm choosing you as the leader. I'm just going to throw you in.
Well, probably I would say, okay, this is me being a devil's advocate, right? Probably the corporate boss, right, was being thrown into the deep sea,
Yeah.
and then you sendiri belajar lah, you learn how,
Yalah,
and they
yalah.
survive. And so this
Yeah.
is with their experience, their learning, how they've learned, they're kind of like, okay lah, I've done it already, I've survived, it's your turn. That is also possible, right?
Yeah,
Especially
it
if,
is. It is. Hmm.
yeah.
Possible. But I think if you start finding that you have some who are struggling, meaning things needs to be done. Things needs to be done. And even if it is you yourself as a manager or you as the owner of a company, if you find
Mm,
yourself struggling, then you have that right to actually uh train yourself, to get yourself trained. Meaning there are
mm,
courses out there on how to manage your staff, how to be a good leader, right? So there's a lot of that. So it goes back to you, if it is part of your value to actually seek for that knowledge, okay, so that you can be a better leader. So I think that's also something that's open as an action that they can actually take in. If you
mm.
feel that you are not equipped enough to be a leader. Mm.
Yeah. I would say that this would require a lot of self-acknowledgement
Yeah.
that this is an area where I need to address,
Mm-hmm.
which is usually very hard for
Mm.
those of us who are not in the mental health field. Speaking about mental health, speaking about feeling stressed is something very uncommon. And it will look like I'm showing weakness, especially in the corporate world. Hey, I am the boss, I should be able to hold everything together. I need to set the example, right?
Mm.
So I think this is where a suggestion that if I may, to corporates, if you are listening, right, have some sort of course or day where you have generation XYZ all coming together and we are going to learn from each other. What has worked in your generation might not work in my generation in this context here, but that does not mean I cannot learn from you.
Mm.
So I would say having this, baby boomers, millennials, generation alpha all together learning from each other, see which strength we can take, and
Mm.
then utilize for the efficiency of the company would be actually something worth looking into.
Mm.
Yeah,
Mm.
we have a few questions, I think. Now, well, let's talk about some comments here. We have
Mm.
two of them saying that, agreeing what we're talking about, how one staff leave and another have to take over temporarily, but in the end,
Yeah.
this person is end up doing this job forever, which is terrible. And another would say that you are not being valued even when you work so hard and take care of few jobs at the same time, which is very true. This is something very real.
Mm. Yep.
And we have Dr. Law.
Mm-hmm.
Let me just have a read what he says. He's an occupational health doctor and trying very hard in creating awareness on mental well-being in the workplace as a whole, to HR and bosses. Well, thank you for doing that. I think we all need people to advocate for this.
Yeah. 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 We need people to start noticing and start advocating for everybody's mental health. It doesn't really
Mm,
matter if you're on the lower ground or you're in the middle or you're on a higher level, because everybody plays an important role in mental health. Okay,
yeah.
because it's is about you recognizing that some people are struggling with their mental health and some people are like manage to breeze through. Some people are really like, okay lah, I can do this. So
Mm,
there's a lot of, but as you said, there are different, different generation here. We have the Z, the X or whatever, the baby, the boomers or the millennial. Okay, but the thing is just the perspective. I think looking at the other's perspective and us looking at our perspective and looking at from other people's perspective also, that can also be helpful. It's like
Yeah.
it's just take a step back and then just notice things around, watch things around. So what opinion that came out about it, and how is this opinion kind of like can be useful for us and useful for others as well.
Mm. Constructive criticism is important. Being able to sit while listening to this criticism is also important,
Yep.
which is something that is, I would say, harder the higher we are in our role at work. So
Hi.
that would require a lot of yes. Who
Sorry
is that speaking?
to
Yes.
the end here.
Hi.
Uh,
There you
yeah,
are.
just because you guys were talking about criticism, just wanted to highlight on Facebook there is a
Please do.
comment. Yeah.
Okay.
Okay, sure. What's the comment?
You want me to read it out?
Oh, please do.
Okay, so on Facebook, Ashraf said that BFM Radio 5 p.m. show earlier downplayed the subject just because the theme was email apnea. Sounded cynical, condescending, ignorant, if not hiding their own truth. It's 2024. Mental health remains a stigma in Malaysian workforce. Treatments and help far from affordable. Emergency hotlines useless. Mere PR stunts and horrible volunteers. Voices unheard. Millions, including myself, suffer in silence alone.
Oh, wow.
Wow.
Any comments on that, Sue-Ann, as you were reading that?
Yourself, yeah, because you were noticing that first. So opinions, man.
Yeah, definitely. I feel his pain. Definitely been there as well. Having been in the corporate role, I'm not sure what email apnea is, but I think having been in the corporate world, I get what he means by feeling very alone, and we have to sort of put up this front, especially as working adults, that we are strong because like we're independent, we're adulting, but maybe inside we're suffering, and it's very hard to sort of let that show, I guess. Yeah, in the workplace.
I agree. And that is something that I spoke to with a client of mine today, talking about how showing weakness, showing any form of emotion will be seen as something that's not desirable in a corporate setting. And we have a comment here also in Zoom saying that the competitive corporate settings create a stigma for both employers and employees that is weak if they show mental health issues at the workplace, because they worry that their work might be affected and even kena fired. Now, this is still very real in Malaysia. Not just in Malaysia, everywhere. It's just talking about different intensity. So from our end here, for Marina and I, we cannot change the system as a whole. That is the reality. But what we can do is, let's start from me. Let's start from us. So if I talk about, let's say, in the perspective of an employer, all right? So you are the boss of your company. And this is especially more real when you are the boss and also the staff of the company when you're an SME. Because, like it or not, manpower is always lacking. And understand that while you can't change the system, you can start with the changes in yourself. Meaning, while you are a boss and an employer in your work and your job, you are not just your job. You have a life beyond this. For those who are parents, you are a spouse, you are a parent to your children, you are married. And if work becomes 100% your own identity, then that is not really taking care of your mental well-being, because other aspects of your life is being affected. And I'm not saying drastic change. So for example, if I would say, take an example of a husband who is a boss in his own company, or even an managerial level, director level, CEO level, you have a lot of people to lead. You probably have thousands, hundreds, how many? And then you have a wife at home, and then you have children at home. Now, probably saying that let's take a 1 week long trip together might not be realistic for you in your current season in life working. But can you take a few seconds, hug your wife before you go to bed? After you have put your children down to sleep. Okay, that sounds, it's not to kill your children, it's like tidokan your children. Okay. And then you're just washing up and you're getting ready to bed, and you have this little bits of intimacy with your wife. Just a hug. Just a few seconds only. That in itself is already learning to prioritize that little bit of I'm beyond my work. Now I'm a husband here, I'm a dad here. So that would be not changing the big system as a whole, but it changed from you. And when you start these changes in yourself, your staff will also see that result, that ripple result of your change. They'll say like, hey, there is that prioritization after a certain hours. My boss is off limits because he is busy being a parent, he's busy being a husband. So training can happen in many different levels. We all know in the lower level where we have employee assistance program, where we hire external counselors, psychologists to speak to the staffs for any issues that they're struggling with, and it doesn't affect their KPI. That's why it's an external arrangement. And then you have training for workers in mental health literacy and awareness, just to improve the knowledge of mental health and reduce the stigma against mental health conditions at work. And of course, you have the managerial training for mental health, which is where like initially we talk about recognizing, responding to your subordinates. And then there's even the higher ones whereby you sit with yourself. And if you think that, hey, I probably would need support too. Maybe I need a support group for top level, the highest level of management. Seek that support. And I am very thankful for the comments that's being shared, things that you're sharing, both in Zoom and Facebook Live, that yeah, it's very sad and disappointing that our voice gets drowned.
Yeah.
Yeah.
Mm.
So hopefully in this session, at least you can voice it out here. How about you, Marina? What are your thoughts?
Okay, before I proceed, I'm just want to say sorry about me doing all this just now. The weird gesture. My cat kept on trying to get into the Zoom. Sorry about that. You just wanted attention. Okay, so I'm back. Okay, I'm able to pay my
You're
full
back.
attention. Yeah. Okay. Is reading that comments from Facebook, it really, you know, it when we trying so much to make an advancement, meaning we want to make things better, we want to make the environment better, we want mental health to be something that is no more a taboo to talk about it, and it's no more a stigma to talk about mental health. But then there are this group of people who are like, really, they're still, they're still at, I don't know, in my mind I'm just thinking they're still in this stone age kind of like era in which they can't move on, they can't really go through the changes, and they're pulling these people back. And kind of like, if you don't agree also, you don't have that right to kind of put people down just because people are struggling with their mental health. You can't ridicule them. Okay, you keep on ridiculing them in a certain way, that, and then you take no responsibility. These people are not taking any responsibility and just say you're weak, you don't, you have mental illness, so there's mental illness, or you have mental health issues, so it's your own fault, when you are also being the one that's responsible for making this person not being able to live with the struggle, meaning you're not helping out. If you can't help out, just be quiet lah. Don't make things even worse. If you, yeah, some people say that if you have nothing good to say, don't say anything lah. Really, it's really sad when people felt like they're not being supported. Yeah,
Mm.
sometimes our own services here in, I think it's not just us. I think even other countries also, it's not 100% kind of like that that supportive. Okay, but at least there's something there compared to before. Before there's nothing.
That's
Okay,
right.
I would say there's something here that maybe we can straighten it out. Okay, maybe it's time for us to kind of like make those changes. Okay, instead of relying on those who have no mental health issues, why don't you yourself, as those who are struggling, meaning you know what you're going through, you have you've been living there, so you can give more support. So if possible, make your own support group. Have your own support group. I think that would be very good.
Mm.
If you need to, open your own support group in your own company or where you're working at.
Mm.
Maybe even macam, let's say you kerja government also. Let's say you're in your own hospital itself. If you're working in a hospital or if you're working in a clinic, have your own support group. Okay, having that support group, maybe there's something, it's a start. It's small, but it's a start. Rather than we are hoping things around us might change,
Mm.
maybe it's time for us to make those changes when there are people who are not, who refuse to kind of like go into those changes. But really, really, it's really sad to see that people are struggling and then being ignored. Okay, even up to the point, because I see there that somebody was commenting about how housemen are not being able to continue their housemanship. Some quit and some just take the action of committing suicide. There are
Mhm.
even specialists who does that, meaning they're already struggling and there's nobody who's willing to support them. They're most of the time they're worried about getting that support because it might mean that they may get penalized. So that, I think it's time for us here, okay, for us to make certain changes. It may not be that big, okay, but at least we can make small changes that will be helpful for us, ourselves, and also for our colleagues and those around us. Mhm.
Yep. Before we go on to our third and last topic for today, building resilience and coping skills,
Mm.
through our sharing of our personal experience, I just want to be a devil's advocate one more time. Please bear with me. Remember when how Marina was talking about how upper management bosses don't see the need to address mental health, seeing that it's weak, is all that. For me, right, if you can flip it and see it from their perspective, I would say that, hey, they started off in a very different environment and context from us today. No, there is almost no such thing as I am feeling depressed, therefore I cannot work. Because if I don't work, I cannot put food on the table. I cannot support my family. Therefore, this is a lot of working very hard to reach where they are today. And during that time, that context, that is the only way to do things. So if we were to put ourselves in that perspective of our boss, then it's only natural that there is this very big reaction of asking them to change. Imagine being 30, 40 years in the industry. They are the pioneers in the industry. It becomes a conglomerate. And now you're telling them that your method doesn't work. But then they can tell you, hey, it worked, or not, I will not be in this stage where I am at now, or not, my children, my family will not be enjoying all this success that we have now. So I would say that it is difficult. It is very difficult for change to happen, especially when we're in that position of we have done the same way for many, many, many years and it has worked. What I would like to say is that I'm not, changing doesn't mean that we are discounting all the hard work that you have done before. It's just that we're now in a different context. And facts have shown that economically, there have been a lot of impact when your employees are lack of motivation, disengaged, which usually means lack of job satisfaction, which usually means it could be struggling with any form of mental illness, or it could be just stresses. So being able to address that for the function of actually your whole efficiency in your work, which also means helping to oil your company to increase in revenue, and retaining your staff so that you don't have so many of these changes and retraining and then they leave again, all these things. That provides some form of stability for your company. So hopefully, if we were to phrase it in this way, helping the stakeholders to see that action to address mental health at work should be done and can be done in a meaningful environment involving your staff and workers, person with lived experience of mental health conditions, right? If they have a say, just a little bit in terms of feedback and all that, and then you hire a group, a team to help you to restructure, reorganize, in just putting in a bit more emphasis on this mental wellness, perhaps change can happen. But it is difficult. It is difficult, but it's not impossible. It just takes a lot of work.
Mm.
Yeah. So shall we go on to the last part of personal experience,
Yep.
coping skills, and then that enables employees to navigate workplace challenges, maintain their mental well-being.
Yep.
We have a lot of conversations happening in the chat,
Yeah.
which is very good. Continue with that. Yeah, Marina, all back to you.
Yeah. I think the fact that sometimes just like I said, small changes can be very meaningful sometimes. It doesn't have to be big changes. Okay. It plays on both sides, meaning even if the employer will actually provide such support, such service, but the employee themselves, the staff themselves need to have that willingness and openness to actually be involved to use that service. Okay. What I'm saying here is one of the things that I've been doing in my own hospital is because I'm involved with the mental health psychosocial support group.
Louder a bit, sorry.
I'm involved in the mental health psychosocial support team in my hospital. So what I did is I offer this kind of like module, okay, because it was requested by the nurses actually. Matron came and matron was asking, okay, can we have something to help the nurses? Okay, so this is a module that we came up, which is a Mind Your Mind module, in which we teach them partly the mindfulness and also value-driven action, which it involve the nurses. So they will arrange every month. I think we've had this this service ongoing with the nurses since the last 2 years. Okay, the fact that the matrons are willing to get this program, requesting this program, that is really it by itself is a success. It doesn't mean that they're all like mentally stable. No, they're still struggling because we can't stop the struggle. But at least we can give them the skills, and not to mention that in the program itself, we teach them where they can actually get help. Because sometimes it's just, oh, you have to do this, and then you get better. But then we forget that. What if they tried everything, but it didn't work? We should provide them where they should go for help, where they can seek. If they need a professional help, where they can go for the professional help. That needs to be involved as well, making that available, get that information available. Even if you in that company, you're not able to provide such, but at least make that something that is possible. I think in the corporate, I think from Sue-Ann and you yourself, you must have involved with corporate who are actually willing to pay for sessions, right?
Yep.
Yeah. I think that's a step, although it may
That
not.
is a step.
Yeah, that's a step, although it may not be that huge or that big. And sometimes maybe people refuse to talk about that. It's all just at the background, right? It's all
Yeah.
on the background. I didn't know until I met you guys. I didn't know that they do pay for the sessions. They do actually employ clinical psychologists, counselors to help their staff out by paying sessions. And it's nobody talks about it. Nobody talks about it.
Yeah, it's not as commonly shared, I would say, outside of the industry.
Yeah.
Mm.
Yeah. So, Anne, is
Yes.
Oh,
this
I wanted to say, I also didn't know my company had when I was in the company. Then I go out of the company or I'm like, I'm the one providing the services now.
Ah,
But so, which I think, yeah, whilst it's important to start from the grassroots, it's important for management to push also because, like, what I notice is it's fair sometimes management also struggle, right? Maybe some of them are very open to hearing out their employees' struggles, but they also will get overwhelmed. And if they themselves can also say, hey, look, we have EAP services, or these are the numbers I know that you, like what Marina said, have the information ready, have the resources ready, and say, oh, maybe you can go and speak to these people and maybe they can support in this way. And so in a way, if we can sell it to them that, look, you are overwhelmed, you are also focused on your business. And when it comes to certain personal issues, it's beyond you already. And so let us like help you out.
Mm.
Yeah. And I think management themselves being able to say, hey, there are these resources or we have these services, go use them. Employees and workers and ourselves will be more willing to go and use them because, okay, boss say can go and use,
Mm.
you know.
Yep.
Otherwise, I remember receiving an email that, hey, that time wasn't EAP or therapy, it was mediation. So they said, like, if you have an issue with a boss or something, you can go for mediation. And it was just an email. It was just like mass email to everyone. And so many times I thought about calling that number, but it just felt so cold because it was just an email and no one talked about it. No one encouraged us to use it. So sometimes there is that issue, and if it kind of needs to come from both like our grassroots as well as from the top down.
Yep. So these are, for me, these are all very, very important information, and these are the bigger picture. If I were to now zoom in, I just like being the devil's advocate and just doing everything opposite. But it's in service of this talk, okay? So if I would talk about like you as the staff, as an employee, you're in a very toxic working environment. You need the money because you need money to feed yourself and pay rent and pay your pets food and grooming and all those stuff. You cannot quit until you can find another option. So in the meantime, what can we do in this very toxic environment? So number one, remember your role. Why am I here? There is a reason I'm still sticking in this environment, even though it's really not ideal. And honestly, nobody really have the privilege to be able in a working environment where everything just ticks the boxes. Everything is nice and ideal. So with this environment here, what I can say is that start drawing boundaries. So for example, if you are on your 1 hour, 30 minutes break, take that break because it is your right. No matter what happens, you are taking that break. You need to go to the toilet within 30 minutes. Instead of, oh, I got 30 minutes, I'm going to try and put even more work to do. It's a very conscious effort to draw that line. And then if, let's say, you're in an environment where there's gossips happening, backstabbing happening, well, do you want to be part of that? Do you have a choice to not be part of that? Of course, there is the risk of doing that will mean that you might get, let's say, you're no longer part of the group. But then would that sit better with you? Would that give you a bit more space and capacity to still be able to service your work at this job? Because you need that job. You cannot just quit simply. So this would be some of the ways. Always take a few minutes for yourself. 3 minutes mindfulness exercise, do it. saying no, learning how to say no, it's very hard. And as with all changes, it's hard, but it's not impossible. Baby steps, start from baby steps. So I had a client here who really fought for her mental well-being by trying to how to say, work with her immediate boss to say that, hey, I need this time to see my therapist, but I will make sure that I will not allow my time, my 1 hour with my therapist, to affect my work. What can I do? How can I do it? So she decided to take that 1 hour of her lunch break to come and see me. And that is difficult. And I would say that, oh man, what about your food? Then I'll be, never mind lah, you just eat lah. Eat here while we have the session. If that is how it needs to be done, that's how it needs to be done. It is tough, it is hard. However, if you think it is worth it, try it. So that's what I can say. And in a smaller workplace, let's say SMEs, what has been helpful is having check-ins with the group. So for example, right, I have this center where the boss intentionally will say, hey, once a month, we'll all sit together before we start, okay? And we will just have a check-in, very quick 5 minutes check-in with everybody, all the staffs, from the janitors to the receptionist to the actual staff. And the boss himself will also sit there and say, this is what I'm struggling with. And here is how I'm trying to work things out. And just having that circle of I hear you out without providing solution is part of building resilience and coping skills. So similar to Marina's social support, only this one is what I'm very impressed to see that it is done in a actual corporate SME level, I would say SME level. So even the stakeholders are part of this conversation, which I think was great, which is where the generation XYZ comes in, understanding generational XYZ. Yeah.
I think
Okay, over to you, Marina.
I saw this comment that talking about having this group, being part of the group in the at the workplace. Sometimes, it's almost like as if you're back to school. I have to be part of this gang. I
At
have
a
to be part
gang.
of this gang, right? Sometimes you have to look at what's the function of you being in the group. What's the function of that group? I would say.
Mm.
Because we always go back to, okay, let's say these are the gossip group. Okay, so what's the function of you being in this gossip group? Is this because you love you like that gossip being that doing this gossip itself, or the fact that you're just there just to be part of, it's just about your socializing. Depends on the function of having your own gang, or being a part of the part of the groups, because that
Mm.
that can is because some people they don't like being part of the group because they felt that I'm too restrictive. I'm being labeled as being this group or that group, or they find that I'm being labeled of such and such. So what's the function of you not being part of the groups? So it goes back to the function of us choosing a certain action,
Yeah.
and how would that be functional for us. So even I think in the government sectors, it can be very, very difficult if you work on your own. I would say,
Mm.
if you're working on your own, okay? So you have to build some sort of relationship, either with uh, the persons who are similar in a similar level as you, or somebody who's higher. You have to have some sort of kind of like certain relationship, meaning what sort of relationship you want to have with your own staff. Okay,
Mm.
do you want to be their friend? Because sometimes you can't be their friend because you're the boss, you're the supervisor, so we must put a limit. But does it mean that you can't be their friend outside? Right? Yeah.
That's
So
right.
you chose yourself. At work, yeah, I'm your boss, but outside, yeah, we can still be friends, we can still be just some companion. Because that kind of like um uh sort of that those sort of things need to be in, depending on what would be the function of it. Mm.
Yep. And what are you prioritizing at this point? Different context, different priority. What sits better with you? What moves you away from the person that you want to be or towards the person that you want to be in this context? So this is also important. So if backstabbing is really not your cup of tea, you do not want to be that kind of person, neither do you want to be backstabbed, then do not be part of that community. And if that means that you would lose friends, then so be it, because you do not want to be part of this inverted comma toxic environment. I cannot share with you the stories that I received. There were a lot of essays. I had DMs coming in telling me, can I know what are all those stories? And I was like, no, this is only for me. This is part of confidentiality. Or
Yeah.
I'll trade you one story with another story. But I've, in the interest of time, and for this setting, no, I will not be sharing all this. No matter how many times I see all these personal DMs now in my Zoom chat also asking, no, it's not gonna happen, everybody. But hopefully you can see the bigger picture, why Marina and I started this conversation. Having this awareness, and this conversation is the start of this awareness, and hopefully change can happen in yourself. And of course, our hope and desire is always change at the bigger system level. It will take time. And there is movements already. So always remember that what is important for you, how do you want to be in this work setting here? If, let's say, you are at the receiving end, then someone else might be at the receiving end as well. How do you want to connect and relate to that person? And then if you are in that stakeholders level, what kind of change would you wish that you can do and can try to advocate for it? Start off with that. So that is from my side. Any comments, questions that you want to ask us, whether on Facebook Live or in Zoom, please let us know. And we have this ongoing discussion. Gossip is not bad, neither is it good. Let's see what's the function of the gossip.
Yeah.
Yep. But backstabbing is bad though.
Yeah.
The gossip was in the context of backstabbing from the story that I got.
The
So
action rather than the gossip itself. I think the back
yes, that's right.
action. Okay. And sometimes being there, hearing the gossip, it just give you a certain idea, kind of like, okay, what's going on here? But you cannot believe all gossip all the time.
That's
Certain
very true.
because sometimes if you just hear things on one side, okay, it's just one perspective when you should explore the what would be the other person's perspective. So don't make up your mind until you've kind of like look through everything. You can listen, okay? The same as when we're having certain thoughts, you can listen to those thoughts, but you can't really say that these thoughts are going to be useful for me now. Okay, so it depends on currently, is this important? Is this something that I should ignore? Like sometimes people gossip about certain things about is this something that I should be aware of? Because sometimes that those gossip can bring you a certain information that can also be useful. But at certain point, you have to be careful so that you will not actually, it kind of like cause more trouble either for you or for the other person.
That's right.
Okay, any more? So there's a question here. Let's see. Okay, what if company hire me for EAP to fire staff with mental health issues? Eugene, you should not ask us this question. You should be answering that question for us. Lah, Eugene. Come on, what do you say?
Yeah, I'm sorry I put you in the hot spot here. Okay, but it is the actual thing that I was asked before.
Yeah, it is.
Generally, we had a discussion with the company. We actually talked about values, and we highlighted both companies' values and also personal values. It's true. Every company will have their own values, or what we like to call as amen's direction, and that's perfectly okay. But if a person they hire is not in line with that, then that person shouldn't be in that company in the long run. This is the general principle that we generally have the discussion. But with regards to mental health, what I did was I remember giving them more of education to kind of tell them, look, there are ways to approach this. There are ways. They might be treatable. They might be demoted to a more useful position. They might even be able to get help and so on and so forth. We kind of work out a solution with them and go about with that. Most companies who's willing to talk to you about mental health are willing to listen. But we also have to be aware of the values and the incongruency lah.
Yeah, for myself, I would really stress with the corporate who wants to hire me for EAP to say that I will not be part of your employees' KPI, whether to hire, promote, or fire. That is not the function of my services here. So I draw a very clear line with that, and I also tell whoever the staff that ends up coming to see me, I also will tell them that whatever conversations we have here, I will not be sharing this information with your higher ups. Neither is this information should be used whether to promote you or demote you and yada yada. That is not the function of this EAP services. So yeah.
Yeah, I think in my own experience, it's when it comes to housemen, in where they come to us, they're struggling, either they've been referred or they themselves come to get help, mental health issues. So, and then we are obliged to actually make a report to the MMC. Right?
Report to MNC.
Medical council. So sometimes, you want to make sure that the houseman is safe, but at the same time you want to give them that support. So sometimes that can kind of like, there's a blurred line between that. Okay, you're struggling to help this, your juniors, you're struggling to help them so that you're seeing them struggling and you want to offer them that help. But then at the same time, you're given this kind of like obligation to kind of, you have to you need to write a report so that this junior of yours can actually go back to work, safe enough to go back to work. So kind of, so I can kind of like empathize with that struggle, although I've never been involved in a corporate setting, but I think it's almost similar to what I'm doing with the housemen. That kind of, place where you have to be the one who's at the same time giving the treatment, but then at the same time you're the one that's doing the assessment, which can be very, very difficult because sometimes it kind of give you that struggle, kind of like, okay, how am I gonna this report? I need to be truthful, but at the same time, I need to be able to write a report that will actually be helpful to this junior of mine.
And that is your struggle and your burden, holding multiple roles, which is different from private setting where we can say, no, I will not be part of this. Take it or leave it. And I would say that this is a need. It is very real. The struggle is very real. Sometimes circumstances is whereby it's either me or no one else. Who else is going to be advocating for this person? So it has to be me. So yeah, thank you very much for sharing that, Marina.
There's a comment on Facebook by Ashraf again. He says, awareness is doing great at the cost of government hospitals now overwhelmed with appointments. More should be done to alleviate this. Subsidies for access to private clinics and meds. I was a documentary filmmaker. I've long wanted to help advocate to push for change, but never found the opportunity to move forward with this. While censorship board will probably never let reality air on national TV, this passion project may never happen anyway.
Oh dear. Well, at least you are able to share it here in this setting.
Yeah.
If anything, you have started the sharing it here. I follow this person on Instagram. The handle is disappearing jobs. So she does it to document and film jobs that are slowly disappearing with the time because times have changed. And I find that inspiring. And who knows, maybe one of these days I'll be seeing your Instagram handle talking about this within your own mini capacity, not on national television, but just within your own social media group, and slowly maybe it'll gain traction. But at least with this disappearing job handle, I really appreciate it. She goes to different countries. She talks about the jobs at here in Malaysia as well. She photographs, she takes pictures, she writes a story about it. So yeah, that is another idea there. But much work to be done. Malaysia is still a growing country, developing. Malaysia, ACBS Malaysia chapter started off with only just a few core group of us, counselors, psychiatrists, and psychologists together. No members at that point. We were the only members. We were also the only coolie in doing everything and anything. And now we are able to expand even bigger. And MSCP is also a very big part of supporting our initiatives as well in lending us support from their side. So it's not, in the grand scheme of things, in this big picture here, maybe we're just one dot. But within this dot, we are making changes in our own capacity. And let's not be disheartened whenever we see all these big stories outside, because we want to remember that, hey, what is important for us now? What are we doing with the life that we have now? Are we making an impact here? And like how Ziyi say, at least we can be the first to make it happen. Let's do it. Yeah, exactly. And Ziyi is definitely not my generation, not Marina's generation. You can feel the energy that he has here. And we need to leverage on this strength and energy, which is where, again, understanding different generation, different contexts that we're all living in, have lived and grow, would help with the initiative. So I would say all this social media, whatever thing, this is where my interns will come in. The Generation Alpha will help me with all these things. Organizing, streamlining, this is where I come in. Marina, this is where Marina comes in as well. Advocating, ideas, spearheading things. Marina is here as well to do that together with me. So everybody in their own capacity can contribute. Perhaps not in the ways that you initially imagine it. And that is okay.
Sometimes if we come about into a certain barrier, a certain kind of like struggle, maybe we just need to take a step back and kind of like, okay, is there any other option that I do have? Because if we do have that willingness, we do have that openness, most probably there are other options. Maybe you can't go, because I would say sometimes you do have to struggle, kind of like you can't say certain things, you can't do certain things. You tried this, and then people will just taro you, kind of like, why are you doing this? You're not supposed to do this. It can't be done. This is not supposed to be happening. And sometimes you can merajuk a little bit. Okay, just allow yourself to merajuk a little bit. Okay, and then after that, okay, is this still something that's important to me? And then are there any other option that I can actually venture in? Is there anything else that I can do? I may not be directly be doing this in this way. Okay, but what if I look into other option? Are there other options? Because if we just see one option, that's when we would be actually be stuck, in the sense that things are not going to change. I'm not going to change things. Okay, but when you allow yourself to see, okay, what are the bigger picture? So maybe, all right, things will not work in such that we say, okay, everything's going to change. But sometimes the struggle are so big that kind of the barrier is so big, the wall is so big. Okay, sometimes what you might have to do is actually not to break down the wall, because especially if the wall are too tough, because walls, it still have holes. So if you can find out those holes, just maybe use that hole.
Regarding the whole.
Yes, gali the hole. Right. Instead of trying to break down the whole wall, cari the hole. What can we do with that? Just a tiny bit of hole, because from that tiny bit of hole, if you keep on digging bigger and bigger, it'll become bigger actually. Right?
Yep. So it is 9:09 now. I would say that summarizes, this is the end of our webinar, 1 hour plus webinar today. So in summary, we identified some of the current workplace stresses, which can look like poor physical working condition, Can look like underusage of skills, can look like workplace harassments, verbal harassments, not being heard. We discuss about mental well-being in the workplace, what would be helpful for individuals and organizations. Multi-level training can happen for multi-level staffs. And lastly, we talk about building resilience and coping skills, sharing our personal experience in the private sector, corporate sector, of course, in the government hospital sector as well. So I really hope that this has been a really engaging talk for you, how I have enjoyed the conversation with Marina. Honestly, both of us were feeling so nervous to have this talk. It was very different from last year when it seemingly looked like a very low stake conversation. Somehow this year it gained a lot of traction and I had a lot of requests on, hey, when is your talk going to happen? It's like, are we going to do it? And Marina's like, yes, of course we're going to do it. And here we are. And of course, again, very deep appreciation to our committee, our team, for supporting us so that we, Marina and I, can focus on actually preparing for this webinar. Without our team behind us, this cannot show up. And every one of you who took the time to just engage with us, share with us with all the comments, thank you very, very much. Any questions, inquiries, please just drop us an email. The email address is in the Facebook post itself, Malaysia ACBS email, and we will get back to you on that.
I think we might as well, if we are open to any sort of topic or conversation that you want us to bring up. Right, Carmen?
Yep.
We are open for that. And if let's say you want to be involved in that conversation as well, we are definitely opening for that. So please make this BORAK session something that we can actually continue on, something that consistently, something that everybody can actually kind of like get something out of it. Okay, so please do contact us if you have any opinion in regard of any topics that you want us to talk in the BORAK session. And please, if you want to join us as well, please do make it
Let us know.
conversation, right, Carmen?
Yeah, let us know and we'll see how we can
Yeah.
arrange that. Of course, with our committee's permission as well. Marina and I cannot just make that decision all on our own. Even though I'm the president next year for ACBS Malaysia chapter, I also cannot veto all on my own. We have a committee where we'll discuss about that. But yes, write into us, malaysiaacbs@gmail.com, or even just PM us, comment in our Facebook page. Let us know. And thank you very much. Have a very good night.